A very good evening. Welcome to Talk of the Nation. This week, the strike by doctors took a major hit or peak, with medical pre-interns joining senior house officers and specialists in the industrial action. There were concerns about health workers that are frequently on strike in the country, but in a major departure from actions, the President ordered the Ministry of Finance and Health to find the money and pay the specialists. This evening, we would like to know why the health concerns or the issues within the health sector are a recurrent problem. To help us answer these questions, we are joined by Anne Lumbasi, a programs manager at CEHURD, or Center for Health, Human Rights and Development. Welcome to Talk to the Nation.
Thank you.
First, bring us up to speed with the recurrent industrial action, strike, and the problems around wages within the health sector.
As partners of civil society that are working around the health sector, that we've seen this year in, year out. We've seen the repeated action or strikes by interns, by doctors. And it's not also just been the health sector. We also saw a few years ago about the education, in the education sector, where teachers were striking. So we feel that there is something that is not right. There's a broken system somewhere where the only option is to come out and strike. And yet there is cost to that. Every time health workers, medical health workers go on strike, there's loss, there's a cost, and unfortunately here there's loss lives. People's lives are lost because they work directly with people. So they are the frontliners to save lives, to emergency cases. So where they go on strike, there is something that is being lost as a country. We are losing human capital. We are losing other things that we may not be able to put hand to, but especially lives are being lost. So that should not be the case. That is the order of the day.
Who is at fault here? Is it a case of poor planning on the part of government, including budgeting for the health sector, or is it a case of the medics and the entire workforce not being alive to the circumstances and realities of the economy?
I don't think that there is fault towards the health workers in this case, because we've had a lot of planning that goes on in government, the budgeting process, the officials at Ministry of Health, and the different sectors that go into the planning and the budgeting processes, whether at local level, at national level. There's these pointers. We should be able to learn from the past. We should be able to look at the trends. We should be able to assess the need and commensurate the planning towards the need that is at hand. It should be a pointer towards the policy makers, towards the planners, to see what is on ground and plan accordingly. So I would think that it is poor planning. I was listening to Dr. Atwini, who was mentioning about how you don't know how many interns are being passed out from the universities to each year. And that's something that is simple. I think we don't have too many medical schools that is out of, that we can't really find out these numbers and plan accordingly. Where we assess this, whether to go to the school administration, what is so difficult for us to at least have an indication of how many medical interns are going to be coming out of their school for that after in their final year. I think that's something that can help in the planning. We've not even come to close to achieving the Abuja Declaration, which was that 15% should be of national budget should be towards the health sector. So I think it is poor planning, but also an issue of priority. Because I think we've seen that the priority is really not there. The other sectors maybe, or we could see that when the money or their issues, especially for political reasons, the money will show up. So when the money is needed for this critical sector, It's Ministry of Finances, they don't have money, and then the Ministry of Health has it, so the budget is always, even for the different sectors, I say that within the health sector, the different arms, let's say the Uganda blood transfusion, they are always given budget that is below what they have budgeted for, so there will always be a deficit.
Some officials in the Ministry of Health and government have often decried the tendency by some medics to not want to be deployed to certain areas of the country. Their concerns mainly lie within the realm of inaccessibility and the fact that there are no services, extra services within the communities there to allow for comfortable living. And when you look at, for example, the Hippocratic Oath, where medics vow to be able to do everything possible to ensure that the patient comes first. You would expect many to allow and go to Kabong, go to Apader, go to Kisoro, or even in the mountainous regions in Mbale and Palisa. Why shouldn't medics also have a heart, so to speak, so that they can allow, within the circumstances, as they wait on government to improve their conditions?
I think it's easier for us to say, yes, I'm not a medical person myself, but I've heard what they go through.
That's right.
I think it's only fair that they are motivated to go to those places. So sometimes it's not really that they are unwilling to go to those places, but because there is no motivation. For health workers, when we saw in the pandemic where they are risking their lives and going to attend to this, by the time we were in the middle of the pandemic, I think they would be willing to go to these places if they were motivated enough. Health workers go through beyond just not having their allowances paid. They don't have things to use, the commodities that they need in the health in the facilities. So it's frustration upon frustration. I don't think that they come from a place of choice that I don't want to go to this place it's because there's no proper or commensurate motivation for them to go to these places.
All right. You spoke about the fact that money or funds can be found when the reason is, as you put it, political.
Yeah.
That means the money is there, but how and where it's going to be allocated is fundamentally the problem. Do you see the possibility that if we had an opportunity to plan, we have the money or the resources to meet the wage demands of the medical workers and also any other person who is within the public service sector?
Absolutely. I think, first of all, for the medical interns, how much they get? 750,000 allowance. That's an allowance that you're supposed to live on for a month. In this economy, that can't get you a house for rent. They are, of course, sent to different parts of the country, Gulu, whatever, and you have to get a house to rent. You have to feed yourself. Sometimes they have family that they have to take care of. I think it's very I don't know how to say, minimal is even an understatement, but really for you to live on that amount of money. Some of the medical doctors are getting 1.8, others, of course, the special, whatever, getting 6 million. But it's very, very little money with the cost of living that keeps going up. I think that we can manage. One of the things I think that where we lose resources, because I maintain that we could find these resources. They are not extravagant. The demands of the health workers are not extravagant in nature. But I think that there is a lot of wastage that happens, that then means other sectors are not, the money can't go around, because the wastage is going through political appeasing, where we're seeing allowances that are abnormal to members of parliament, to for those political reasons, and also the numbers that we have. I don't know whether it is important to have a parliament of over 500 people and how much they are contributing to the issues of making laws. I know that is a bit on the whatever, but there's also wastage that is going through corruption. We've seen the recent scandals that have happened in the OPM. That wastage, if we are not managing that wastage, where the money is seeping through, we are going to continue having less resources to allocate to critical sectors like health.
President Yoweri Museveni coming out and directing the Ministry of Finance and Health to attend to the demands of the latest group to go on industrial action sets a precedent that if we push harder, if we demonstrate and put the government on the wall, then the money shall all of a sudden be available. And this tells any other worker within the public service that perhaps we are not pushing enough. So let's also push enough and be able to be attended to. Do you think the president's directive, despite the fact that he is very intent on ensuring that scientists are well paid, creates a bad precedent?
Absolutely. Because as a government, we shouldn't be reactionary. We are waiting for citizens to rise up and, bring us to book for us to act. Systems should be working effortlessly, because that's why we have leaders, that's why we have sectors with leadership within those sectors, that's why we have processes, that's why we come up with the plans like the National Development Plan. So it should be able to have, the country should be able to have systems working and running, implementing the policies that it has set in place, not to wait for an exhibition, not to wait for a strike for them to act, because that opens a Pandora of actions that say now different sectors and different actors are going to think that's the way to go. I will come out and exhibit, I will come out and put a demand and my demands will be met. And also where the others, within other sectors where they come up and they don't get the same reaction, what does that communicate to the rest of the country?
Okay. We shall, of course, keep our ears to the ground as the media for any developments with regard to that particular issue and any other that can help in streamlining issues within the health sector in the country. Anne Lumbasi, many thanks for the perspective and insight. Anne Lumbasi is a programs manager at CEHURD, that is the Center for Health, Human Rights and Development. And of course, those perspectives there should embolden your understanding of what is going on within the health sector. This is Talk of the Nation.